So welcome everybody, and once again we do want to thank Janssen Pharmaceuticals for their support of this programming. Really happy that they allow us to be able to bring you these kinds of resources. So I'll just first off introduce myself. I think most folks, if you have been in any of the previous webinars, know me already. My name is Jager Spratt. I am the Advocacy and Treatment Access Program Manager here at PHA, and I will turn it over to Katie and then Laura to introduce yourselves.
Thanks, Jagger. Hey, everybody. I'm Katie Kerner, and PHA's Vice President of Advocacy and Patient Engagement.
And just so you know, Jagger, I'm getting messages that people can still only see you. I'm not sure if they can when I'm talking.
Okay.
But anyway.
Okay.
My name is Laura Nowicki, and I'm the Pulmonary Hypertension Nurse Coordinator at UNC Healthcare, and I've been doing this for about 9 years, and I'm happy to step in for Danielle, and I look forward to your questions.
All right, awesome. So yeah, I think for folks who are having trouble seeing the panel of speakers, on your end, you may need to adjust your own view to be gallery view instead of speaker view. So hopefully, Angela, if you were able to maybe tell people where on their screen they might be able to find that view switch, just to give folks a little hint. I know sometimes the Ring Central platform can be difficult to navigate. But yeah, so I think we hopefully are going to be able to have people see us all.
I'm sorry, I'll jump in. You should, at the top, if you're looking at the screen, the top right corner, it should say speaker view or gallery view, and you just click on it and it'll adjust. So if it's on speaker view, it will adjust to gallery view.
Alrighty.
Some of its top right view options may be for other devices.
All right, so we'll hopefully give folks just a little minute to work through the technical difficulties, but I will go ahead and just roll along. I've just got some announcements, so we're not going to get right into the paneling stuff anyway, so y'all have a little bit more time to figure out how to look at all three of us. So first off, I just wanted to remind everybody again, we have these important dates, the open enrollment dates for this year. And as a note, Medicare's open enrollment period did start almost 2 weeks ago now. So you do definitely want to be looking at your plan options right now. You've got a little bit over a month left to do your homework and research and figure out what options for coverage you have to choose from. And then for those of you who might be looking at a health insurance marketplace plan, that open enrollment period starts next Tuesday. And then as far as commercial plans, that again, you'll want to just be checking with your HR department for enrollment dates. So for some folks, that may have already started. I know I got a message from one person whose enrollment period actually closed, like I think yesterday or something. So definitely make sure you know when that's coming up for you. And then I also wanted to remind everyone of the great resources that we at PHA have for you. These 3 bullets here are just some good starting points. We really have a wealth of information on insurance topics on our website. So that's the link there to go and check all those resources out. If you're looking for financial assistance, our page there is very comprehensive and it's got a nice easy URL, just phassociation.org/help. We do try to keep that as up to date as possible as we learn of grants opening or closing and try to add new resources to that page when we learn of them. So that tends to be a pretty up-to-date resource for you. And then if you do want to reach back out to me with questions about treatment access or financial assistance questions, you could use that email there, that insurance@PH Association, and that's going to go right to me. And then you can use that number to call me as well. And then outside of PHA, there's, of course, other good resources too. So definitely give the Medicare Rate Center a look if you're looking for some Medicare answers. And the healthcare.gov is the marketplace website. They definitely have tried to make that pretty user-friendly, so you should hopefully be able to find out what you need to know just right there on their website if you're buying an individual plan from Marketplace Health Exchange. And if your internet searches and also this webinar series have still left you with questions, a really great resource that's out there is the Patient Advocate Foundation. They actually have a service for free case management, and those are to any and all patients with chronic or serious illnesses, which includes PH. So you can either call them and you will be talking to a person, or you can also submit a form online if you're more comfortable with an online interaction. And so their case managers will work with you like one-on-one. They do have the knowledge and resources to help you through the process of navigating your individual circumstances and actually help you choose a plan, which that is not really something that PHA is equipped to do just because of the nuance to different insurance plans and just how much it varies in different areas of the country. It does take quite a bit of detail to really be able to tell any one specific person what is the right choice for them. So that's not something that we're going to do. But that is something that they can do with those case management services. And then just as one last reminder, as Danielle was telling us last week, it's really just so important to be talking with your care team early and often. Just reach out, ask for help, keep asking questions, keep following up if you haven't heard back about something that you asked. And really that old adage, the squeaky wheel gets the grease, really can be true in this case. All right, so one other piece before we kick off the questions that I wanted to revisit, one question that we had gotten last week, which I didn't know the answer to. I looked it up. Someone had been asking about how Medigap policies work for folks who are eligible for Medicare through disability but are under 65 years old. So it looks like generally speaking, there's a good chance with a Medigap policy it is going to be more expensive for you if you can get one, which depending on what you apply for, you might not get it at all until you turn 65. So there are some exceptions in 27 states. The Medicare supplemental insurance companies are required to sell at least one Medigap policy to people under 65 who receive Medicare benefits because of a qualifying disability or a medical condition. But note, not all plans are created equal, and some of those states do also apply restrictions to that requirement. So if you wanted to learn more about which states those are, what details those are, you can check out medicaresupplement.com. That's where I got this information, and I've got that website linked in on the slide, and I think Angela has just popped it into the chat as well for y'all to reference. So just as a reminder, that Medigap open enrollment period does only happen once, and it is the 6 months after you both have turned 65 and are enrolled in Medicare Part B. So this is the one time that you are absolutely guaranteed not to be subject to medical underwriting. There are a couple of other times where you might have an exception, but those are kind of more circumstantial depending on like if you've lost coverage, then you might be able to get it back without having underwriting. But in terms of just like going in and getting Medigap policies without dealing with that underwriting requirement, it's when you turn 65 and have enrolled in Part B. So if you have a Medigap policy, it's definitely possible that you will be able to get a better rate if you reapply once you do turn 65. Okay, so that was a little bit of like a deep dive into detail right off the bat, but
Jagger, we lost your volume. Jagger, we can't hear you.
okay, is the sound back now?
Yes.
Cool.
Much
I
better.
always forget to do that. Okay. So we're gonna switch over to the Q&A, and yeah, if folks could use the Q&A function rather than the chat, that'll keep all those really useful links easily accessible for people to scroll through rather than scrolling through all the questions in the chat. So I'll go ahead and turn it over to our wonderful moderator, Angela, to read out your questions for us.
Yes, so we do have one so far, and you may have touched on this a little bit. So from the previous meeting, I learned that changing provider of Medigap may be subject to underwriting. How about changing plan with the same Medigap provider? My existing provider now provides plan with dental coverage, but I worry that when I switch, it will trigger underwriting. Please advise.
Okay, so yeah, that is definitely a good question. From what I've been able to look up, and this is definitely one of those more squirrely questions that is, it's very into the weeds. I think it is possible if you are outside of that 6-month period, if you are making any changes to your Medigap policy, that you might end up triggering that underwriting. I don't know if it's a guarantee that you would always have underwriting, but I think pretty much any time outside of that 6-month period, there is a risk of them trying to do underwriting and then potentially changing your rates. Yeah. We'll go ahead and give folks just a couple of minutes to potentially type out some questions, because I know it's not as easy as just like popping into like speak as though we were in person. But yeah, and we are definitely welcoming any and all questions about insurance. It doesn't have to be restricted to Medicare. You can ask about other things. Laura has a lot of really great expertise as a nurse, and she can talk about different kind of medication questions, or I don't know. I mean, Laura, if you want to give like some topic suggestions or prompts to folks, then you're welcome to jump into that as well.
Okay. Let's see. I would say, gosh, I'm trying to just come up with something. I feel like I'm asked a bunch of questions every single day about insurance and about this coverage. Always this time of year is tricky. What we were discussing before we came on is the importance of your formulary. So every year, the insurance company can potentially change their pharmacy's formulary. So if you are told that this year you've been on a medicine for years and years and it's been approved just fine, and why is it changed this year? It may be because they no longer have a contract. It may not be their preferred drug. The preferred drugs, unfortunately, can change every single year. So that's what makes that a little more interesting at the beginning of the year, every year. Let's see, there's another question, it looks like.
Yes. Can you talk about the Medicare Advantage options? Is this mandated in some counties for those that have Medicare and Medicaid?
Yeah, so I don't believe Medicare Advantage is ever mandated. I think it is, you have Medicare like original, and then as an option, there is Medicare Advantage. It's an alternative, but I don't think it's ever mandated.
Okay, and then we do have another question. I'm sorry, was there an additional answer, or?
Yeah, Laura or Katie.
I don't have anything else. I wish we could talk to folks, because I feel like there might be something else in this question. Sherry, if there's, I agree with Jagger that I don't know of any situations where you have to be on Medicare Advantage rather than original Medicare, but if there's something else here about dual eligibility for Medicare and Medicaid, just ask again.
And so we do have some that have come in through the Q&A. First, I will be using Remodulin covered by Part B and will sign up for Plan G to pay for costs not covered by Part B. I'm concerned if Part G will cover the costs.
Okay.
Laura, is that one you have experience with?
Yeah, I can answer a little bit of that one. Let's see, I lost the question. It scrolled up. Let's see. Yes, Medicare covers Remodulin under Part B. As far as the Part G, the best that I can understand, they will cover additional costs associated with the Remodulin. I think like the supplies and such, that is covered under under Medicare Part G. I don't think that that would be a problem, but also what we have done in the past for those that don't have a Medicare Part G, because it's not too common that we see that a lot of people have that, we do rely on Assist or some of the foundations that are out there that can obviously help you with those additional expenses. I hope that answered that.
Okay, and we have a couple of questions coming in now, so this is great. Our next question, I'm trying to get on Tyvaso DPI and may be able to afford it now as I am in catastrophic phase of Medicare, but next January it will get more expensive. Can I switch back and forth between powder and liquid Tyvaso? Maybe this is too much of a medical question.
Okay, I can answer that. And no, that's not too much of a medical question. I think that's a very good question. And I think right now this is on the minds of a lot of our Medicare patients. Fortunately, Tyvaso DPI was introduced, and it has been a wonderful thing for a lot of patients that have been on the nebulized Tyvaso for many years. It's going to make things a lot easier. Unfortunately, though, it is only going to be covered under a Medicare Part D plan, whereas traditional Tyvaso is covered under Medicare Part B. I do fear that Medicare patients are going to struggle getting on DPI and being able to afford it. I think it's going to throw you in a donut hole pretty quickly. So we are recommending right now, until we can kind of see what's going on, that patients that are Medicare stay on the nebulizer just until this, since it's such a new product, and we're not seeing, we haven't seen the full effect of what's going to happen at the beginning of the year. So I would recommend at this point probably staying on the nebulizer, because switching back and forth is not, that's not a very good option. That's going to get really expensive and get really confusing. And if the doses aren't identical from one to the other, so that may get kind of tricky also. But I would recommend talking to your physician for sure.
Okay. And the next question, are compounded medications ever covered by prescription insurance?
I don't know the answer to that. I have not had luck with compounded medications being covered because they are so specifically made, and I don't know if they would have to do, we've not had luck with that. I'll just say that. I don't know about all prescription plans. I'm sure that there are some out there that are different. Again, this is kind of where we're talking about that was pretty specific, and I think it would depend on your individual plan, and you would have to check with them. But they're hard to get covered.
Okay, let me look at some of these in the chat as well. Let's see here. I don't know if we answered. Can you talk about Medicare Advantage options? Is this mandated in some counties for those that have Medicare and Medicaid? I feel like we answered, but I'm not sure.
I think that was that first
Okay.
one. But then I think Sherry had said later on, with the impression of the patient that county Medicaid wanted this option for the patient. Okay, so like someone's has Medicare and Medicaid is encouraging Medicare Advantage, I think is how I'm interpreting that question. Okay. I mean, I think that is probably going to be in terms of like, you know, what that patient should do. it would surprise me if there was a situation where Medicaid was requiring someone to take on a Medicare Advantage plan. Like that sounds strange to me. I don't think I have the knowledge to back up like the exact rules or regulations of like why that would or would not be allowed, but it just sounds off to me. Katie, feel free to jump in.
I don't have anything to add.
Okay.
We can certainly dig into it a little bit further. And
all right, let's see. The next question, if your drug is on their formulary when you check in December, do they have to keep it all year?
When you check it in December, that's probably actually, unfortunately, the worst time to check it because it's going to change majority of the time in January. I would say checking it in January, and then because unfortunately we don't know in December. A lot of patients will call us and say, is this going to be covered next year? And a lot of times it's very unfortunate that we have to wait until that very first fill in January when patients are told, okay, this is no longer covered. I wish that there was a better way of knowing ahead of time, but it's just unfortunately not the case. Katie, do you know of anything else? Or Jagger?
oh, unfortunately, my reaction was we wish it stayed the same from December through the remainder of the following year. That would make everybody's lives better.
Easier.
But no.
Yes, agree. Okay.
The only thing I know, and this is just like literally earlier today, I was like trying to practice myself of like looking up a formulary, and it looked like there was an option to look at like 2022 plans and then 2023 plans. But I don't know that there is a guarantee that what is in there currently for the 2023 plans would remain the case on January. I think they would still be allowed to change up until December 31st, I would assume. But this is also a little bit outside of my area of expertise.
I would assume that as well. I feel like this changes every single year and we never know exactly what to anticipate, unfortunately.
Yeah, I do think with the Medicare plans, like in theory, they are supposed to have their formularies set before open enrollment so that folks can check and review them. I mean, that's advice that we hear and give all the time, is to double check the formulary before you make your decisions. But in terms of will it stay the same through the full length of the upcoming calendar year? Hopefully, but there's no guarantee.
Now we have about 2 more questions. The first is, what are all these parts beyond Part D? So I know we mentioned Part G earlier, so if there's an overview y'all can give about that.
Those are all actually just Medigap policies. So there's a whole set of additional letters that represent different supplemental coverage that folks with original Medicare can purchase if they wish to at specific times in their Medicare eligibility. So Part G is one example of a Medigap supplemental policy.
I do also remember reading something about Part C, which would be like Medicare Advantage, and Part F no longer being available to people who qualified for Medicare after January 1st, 2020. I think there's something about maybe like Part B coverage. I would have to look more into it. But I know in terms of like the differences between parts and what Part G versus Part F is, like I think there are some differences, but broadly, yeah, what Katie said is, you know, there are other like variations on supplemental, but the primary parts that you need to know about and that aren't going to change are like A and B for hospital and for outpatient, and then Part C being the Medicare Advantage plan, and Part D being prescription drug coverage. So the ones after that are less solid or like less consistently used, I think. And by consistently used, I mean in terminology, not like people using them, but like that terminology will be less consistent like across the healthcare system.
And lastly, we had something in the chat. Can you please elaborate on patient advocacy case management scope? What other case management assistance is provided and for how long?
Yeah, so for the case management with Patient Advocate Foundation, so it's not a long-term thing. Generally, I think they can answer maybe like one or possibly two broad like questions that you have at a time. You can always submit another question. I know when I submitted a question online, it said, please allow like 3 business days for the case manager to get back to you. And I was able to submit like 2 different types of questions. That was with their online form. So if you talk to a person through the phone system, I'm not quite sure if you might be able to like ask a couple more questions that way. But broadly, the things that they cover are like access to care. So that's going to include like figuring out which insurance coverage to get. They can also help you through like an appeals process or like appealing a denial or something like that. They can also help you figure out like applying for disability or for Social Security or supplemental security income. They do provide resources for financial assistance, so they don't have money themselves, but they are able to guide you kind of in a similar way to what I would do for folks who call asking about financial assistance. They can point you towards different available resources and see which ones you might qualify for. So it's definitely a shorter term case management. They're not necessarily going to be sticking with you for like months on end, but for this situation where it's like I need help figuring out my insurance plan, which option is going to be the best for me, that is something that would fall within their scope. They do also have a pretty good list of like explanations of what they do on that website that was linked. So if you go there, it provides a lot more information about their program.
Jager, I want to add also what we have done for some of our patients is we encourage them to utilize the advocates at the specialty pharmacies.
Mm-hmm.
Also, CVS Specialty and Accredo both have patient advocates that can help answer some of these questions. Sounds like they, that what you're talking about might be a little more specific to insurance specific questions, but the folks at the specialty pharmacies can certainly help by guiding with financial advice as well as far as foundations go. And they have been helpful to some advising on what patients should do as far as thinking about disability and some of those sort of things too. So that's another avenue that you could try. I do know that for us specifically, those folks do stay with those patients for quite some time, and some of them actually have pretty good relationships with one another and getting to know them. So that does help too. So you could reach out to your specialty pharmacy and ask if that's an option for you as well.
A great tip. Yeah, thank you, Laura. Yeah, your full care team, including your providers and your specialty pharmacy. But yeah, definitely reaching out to the specialty pharmacy. And I know there's like a specific like section of CVS's structure that is just dedicated to pulmonary hypertension, and same with Accredo, that they do have a team of folks, which I know sometimes getting through their like phone tree system and stuff can be a challenge, but they do have dedicated people out there to help you.
So the next things that we have are actually, I think, more statements than questions. I have applied for and received grants for 6 years. However, last year was able to receive a grant for only 1 drug. The second drug was covered by the pharmaceutical company. And I'm sorry.
Oh, I can, yeah, just kind of briefly respond
Okay.
to that. That's not an uncommon experience, unfortunately. Yeah, this past year was really rough for making, finding that supplemental like financial assistance, particularly for folks on Medicare who typically rely on those like nonprofit foundations. it was like a good month or more of just nothing being open at the beginning of the year. And I know everybody was scrambling trying to find coverage. And then, even after that, definitely I've had folks calling me periodically throughout this whole year. My coverage has run out, my grants run out. Definitely the manufacturers had to step up and cover a lot more than I think they typically do. And actually same with even the specialty pharmacies. I know Danielle was kind of mentioning that like step-by-step process of if there's no grants, ask the manufacturers. If you get denied by the manufacturer, you can turn to the specialty pharmacy. And a lot more people than usual this past year have had to do that. What it's going to look like for next year, who knows? We certainly hope it will not be a repeat of this year, but I certainly wouldn't make any guarantee that it's not going to be the same. So yeah, I would say just as general advice there, the sooner you can start applying, the better. But even if you do start applying early, it's not necessarily a guarantee that anything is going to be available. So just staying persistent, I think, is really going to be your best bet.
I think I'm going to speak to this too, just for a second, just to kind of echo what you were saying. Last year was by far the worst that we've had, and we had to get fairly creative. So I think just making sure that your providers know if you have financial assistance that is running out, which most of them are at the beginning of the calendar year. And if you do receive letters that recommend that you fill out forms or have a date, or we had people who were waiting, and we would call and say, go ahead and call now, but they got a letter that said, no, you should wait until your day of this date, blah, blah, blah. It's really important to just keep open communication with your provider's office, with your nurse coordinator, if you have a good relationship, for sure, just stay in touch with them. We can help you a lot sooner knowing that there's going to be an issue rather than trying to catch up on a Friday afternoon when you have no medicine, there's no foundation funds, and then we're all scrambling, and we don't want you to be out of medicines, and we certainly don't want anyone to end up hospitalized. But it's so, so important to keep up with things, watch your mailboxes, take phone calls maybe that you wouldn't necessarily normally take. I know that unfortunately robocalls have made our lives completely miserable because patients don't trust calls that are coming in from like foundations, or if they're notifying patients that that there are things that are coming open, or if your physician's offices are calling. It's a really important time just to be very aware. If you don't have Fund Finder, I think that was mentioned earlier, that is extremely important. It's on Penn Foundation, I believe, isn't that right? You can go to Fund Finder, and what that will do, by signing up, you will actually get either an email or a text, whichever you select, and it will let you know when a foundation opens. And when that opens, that is the time to jump on it. These foundations last year were open and closed extremely fast. And I had patients, unfortunately, that, well, I'm in the middle of something, I can't do it right now. That is when you absolutely have to stop and do it and call. These are very, very few and far between. So when funds are open, you're competing with everyone else in the country that's trying to get on as well. And it's important to stay diligent, stay on the phone. And it's not fun for anyone. And, this is just, it's just what it is. But Fund Finder, I believe, someone just asked again, where is that? I believe it's on Penn Foundation's site.
Yeah,
It is.
I know there.
But there is a site, I forget, I've done it a million times, but I can't remember if it's a site of its own that you can just type in Fund Finder.
Yeah, I think if you search Pan Fund Finder, it should come up. We can for sure. Okay, actually, it looks like someone maybe put it in the chat.
Oh, good.
So perfect. Thank you,
I think
guys.
that is huge, just having that, because that will let you know for sure when things are open, and that's time to jump on it.
Yep.
And Laura, I'll just echo something that you said earlier, which is the importance of setting yourself up for success in this process by letting both your healthcare team and your specialty pharmacy know what to expect in your healthcare in the new year. So by that, I mean, particularly if your health insurance is changing, it is no one's job but your own, unfortunately, to let your healthcare team and your specialty pharmacy know about that change. So you as the health insurance consumer do need to have that communication, but having that communication as soon as you know what your coverage is changing to can really help your healthcare team get ahead of that change and be prepared for the new year.
And that goes to say I completely agree, Katie. I think that's important any time of the year, because oftentimes we find out from the specialty pharmacy when they've tried to run a prescription, it won't go through and nobody knows why. And when I call the patient to say, did something change? Oh yeah, I got new insurance last month. If we don't know that, we can't do anything about it. And that leads to an emergent prior authorization. And as you probably know at this point in the game, prior authorizations are not approved immediately 9 times out of 10. And there is a wait period. And unfortunately, that will mean that you are without medication. There's not much that we can do about it. So always, no matter what time of year it is, especially the beginning of the year, if you know something's going to change, absolutely let us know. But I would say just going forward, anytime you have a change, it's so important to let us know, because we won't know unless you tell us.
Okay, and then the last thing we had was just more discussion on the different parts. Part B is divided into many different plans. Those are something like A through K or L. These plans are all the same for every insurance company. They are each slightly different, i.e. coverage out of the country, other options.
That's a great clarification of the Medigap structure. So again, we've heard this all before, but Medicare Part A, Part B for durable medical equipment, Part quote unquote C, which is actually the private insurance Medicare Advantage, and then Part D for drug coverage. The Medigap plans being that supplemental policy, and this is just the commenter is making a great clarification on the conversation that we had earlier, that there are multiple Medigap policies, that they are also labeled by letter confusingly, and that each letter represents a slightly different coverage option. Supplemental plan. And to Jigger's point, a couple of those plans were sort of permanently discontinued. The letters are no longer in use in most parts of the country, but that's what you're hearing with those additional letters.
Thank you. And then someone just asked where we could find the recordings of the previous webinars. I did put that in the chat. We will also send out an email that has the links for all webinars once the series concludes, but the previous 3 weeks are already posted on PHA's website.
And in that same email that's going to be going out that has the links to all of the recordings, I am going to be including that frequently asked questions document. So I'll try to make sure that all of the links that we've been talking about will also be available in that PDF document as well.
There are no other questions or comments at this time, but you guys are great. Thank you, has been sent in the chat.
Thank you guys. Well, I really am glad that we've been able to bring this resource to y'all. I know, yeah, Medicare in particular and just health insurance in general is really intense, really confusing, and sometimes like really time sensitive. So I hope that this has been a timely and helpful resource for everybody, and definitely really proud that PHA is going to be able to have these recordings up and these resources available for everyone else who wasn't able to attend these in person. And also just thank you guys for such great questions. I know a lot of these got like really in the weeds, very detailed, and I think that's great. I know, we're not necessarily able to answer all of them, but just knowing kind of what questions y'all are wrestling with is really helpful. And we are going to try to take those into consideration and figure out other resources, other programming that we can do in the future to try to address those deeper questions too. Any closing thoughts from my fellow panelists?
I know this is primarily insurance-focused conversation, but I think the financial assistance conversation is just so important, and I know that's like the next thing on everyone's mind immediately after open enrollment. So I will say again that PHA does have the phassociation.org/help page that includes a link to PAN's Fund Finder, as well as everything that we know as it happens about which funds are open when, just so you have one more place in addition to your healthcare team and your specialty pharmacy that you can, if you're trying to remember where to find that information, there are a couple of options.
Yep, definitely. That is pretty much my go-to whenever anyone asks me a financial assistance question. I'm pulling information from that page. So yeah, phassociation.org/help. Can't say enough how much good information is on that page. All right. Well, Laura, I want to extend a special thank you to you for jumping in at the last minute. Really, really appreciate you being willing to step in, and appreciate you sharing your expertise with everybody.
Sure, it's my pleasure. Thanks for having me.
Yep.
Thanks, Laura. Thanks, everybody.
Yep. Thank you.
Great. Bye, everyone.